Assalamu alaikum guys, welcome to my YouTube channel Orthopedist. I hope that you all are doing good. So guys, before starting our new video, I have to remind you that our previous videos includes the orthopedic surgery, it includes fracture detail, it includes tumor detail, bone tumor detail. So guys, if you still don't watch these videos, and go and watch these video completely. So guys, our today's topic is very interesting and useful in the field of orthopedic, which includes infection. In this video we will know that what is infection and what are its type and what are basically the bone infection. So let's start with the definition of the infection. That what is infection? The invasion of the bodily tissue by the pathogenic microorganisms that proliferate, resulting in a tissue injury that can progress to the disease. This is infection. When something is introduced or proliferate means enter into your body. Further we will see that what is the thing which prevent the infection. Infection prevention refers to the policies and procedure used to minimize the risk of spreading infection, especially in the hospitals and the human or animal health care facilities. So that's we prevent the infection. Now we will see that what are the stages of an infection disease. You can see the graph in which the first phase is invasive phase, second one is acme, third phase is decline phase, and this graph is between the number of infectious agents versus time. Incubation period, no sign or symptoms in the start, and prodromal phase where vague symptoms introduced. So now we will see that what is the bone infection. It is a type of infection in your bones. So let's see this diagram in which there is infection in your bone. This one is the early and the late. It causes medullary fistula. Okay. What is called the bone infection? It is called osteomyelitis. So let's see what is osteomyelitis. Osteo means bone, myelitis means bone marrow, and this means inflammation. So it is basically, osteomyelitis is the inflammation of bone or the bone marrow, results from an infection. Let's see its definition, that it is an infection and the inflammation of the bone and the bone marrow, and it is an infection, usually painful inflammatory disease of a bone, often of a bacterial origin, that may result in the death of the bone tissue. So we have to treat it. If it is chronic, then it becomes severe, persistent and incapacitating infection of the bone and the bone marrow, and the term used for the chronic is the pyogenic osteomyelitis. Let's see the symptoms and the signs of the osteomyelitis. You will see fever, feel fever, fatigue, tiredness, okay, nausea, limited motion range, irritability of or lethargy in the children, redness in the infected area, swelling around the infected bone, pain in the infected area, tenderness and the sensation of warmth around the infected area. Now the most important thing is the treatment of the bone infection or the osteomyelitis. It includes antibiotics and the surgery. Antibiotics to prevent the spread, and surgery is caesarization. Further, it includes medical treatment, local treatment, and surgical treatment. Surgical treatments are very important to eradicate completely bone infection. Treatment includes diffuse forms of chronic osteomyelitis, small intraosteal cavities without the expressed sclerosis, availability of the complications, difficult access to the focus and bound with it, efficiency of conservative treatment which was applied with the purpose of the preparation before operation. So guys, if you understand what is the bone infection or basically infection and what are the treatments and the sign and the symptoms of the bone infection, then go and like my video, subscribe my channel, and wait for the another topic which is on your joint infection. So wait and watch. Allah Hafiz.